The pandemic created a number of health problems in addition to COVID, and now we're learning more about how it's impacted children's overall health. ABC 10 News reporter Jared Ahrens takes an in-depth look at childhood obesity and why it increased so much in the past year.
Alexis Avila began having weight problems when she was 16.
My mom, she noticed that things weren't really going well with me.
That was right before the pandemic started. As the months went on, staying healthy became more difficult.
At one point, it was getting kind of hard since I couldn't see any more friends and it was kind of like isolating. It was kind of a hard point in my life.
A visit with her doctor helped turn things around. Alexis changed her diet and her routine.
I've also been a lot more into exercise, which has definitely helped me mentally, physically, and emotionally.
Her doctor, Cherie Chu at Sharpry Staley, says Alexis' story became common during the pandemic as she saw more kids struggle with weight.
So if you had a kid who was following their growth curve previously like this, we were seeing just jumps up on that curve. And so that's pretty much across the board.
According to a new study from the CDC, childhood obesity rose significantly during the pandemic. The study looked at the health records of 432,000 kids across the country. It found 19.3% of them were obese in August of 2019. A year later, that number had jumped to 22.4%.
For an individual child, it meant that instead of gaining 1 or 2 pounds over 6 months, they may have gained 7 or 10 pounds over those 6 months.
Rady Children's Hospital Dr. Jeffrey Schwimmer says that can lead to long-term health problems like heart and liver disease, high blood pressure, or type 2 diabetes. He compares that study to a check engine light for the health of the country.
When you look under the hood, you see that a lot of children had really no change, no difference, but those children who were most susceptible may have actually gained not the 7 to 10 pounds, but even 20 or 30 pounds.
The study also found kids who were already overweight or obese and kids aged 6 to 11 had the biggest jumps in weight. Dr. Shu blames the chaos and stress of the pandemic, which led to changes in how people eat, sleep, and exercise. But she adds, that's a problem we can fix.
While it's concerning, I feel hope that people can shift course now. Kids are back in school. We can kind of get back to what we used to do before the pandemic hit.
That's what Alexis did. She lost more than 20 pounds and says if she can do it, any kid can.
Do it for yourself. Do it because it'll make you feel so much better and your confidence will grow tremendously. You'll feel better at the end of the day and you'll just be the best you could be.
Dr. Chu says an easy way to get started is to remember 4 simple numbers. 5 servings of fruits and vegetables every day, 2 hours or less of recreational screen time, 1 hour of exercise or outdoor activity, and 0 sugary drinks. At Rady Children's Hospital, Jared Ahrens, ABC 10 News.
Good tips. Pediatricians also tell ABC 10 News it's important to make a plan with your child's doctor for weight loss and keep up with yearly physicals.